My name is John Washington. I am a Yupik Eskimo, originally from the native village of St. Michael. In my time working for Norton Sound, I've worked in long-term care, inpatient services, ER, emergency room services, and labor and delivery. Apart from that, I also volunteer as an EMT for the non-volunteer ambulance department. From a young age, I have been interested in the medical field. Looking back, like growing up from the stories of my grandparents, I've always been told of how resilient and strong our Native people are, facing many hardships, from famine to diseases to the harsh weather here in Alaska. And it just got me interested in wanting to help other people.
Hi, my name is Catherine Sawyer, and I'm the Director of Pharmacy at Norton Sound Health Corporation. Norton Sound Health Corporation is a critical access hospital that's in rural Nome, Alaska, so we're very remote. We're off the road system in Alaska, so it does pose a lot of challenges, but my pharmacy staff is always up for those challenges, going above and beyond to help take care of our patients. So we worked with our materials management crew and immediately implemented a prescription delivery service to not just the patients that are in the Nome area, but also utilizing our health aides and our village clinics. We're able to do delivery services to our patients that live in the villages also. So that helps cut down on traffic and patient interactions, which could have potentially spread COVID. I'm just really proud of everything that the pharmacy is doing to help take care of our patients in these very challenging times.
Greetings from Ho-Chunk. Ho-Chunk has no reservation but scattered trust areas, so our medical services team of providers, nursing, radiology, laboratory, optical, dental professionals, and our office manager care for our Ho-Chunk and other natives who reside in 15 counties in Wisconsin and 1 county in Minnesota. As the pandemic loomed towards our tribal communities, this team wasted no time to stagger provider schedules that minimize patient contact with one another. The nursing team assumed the scheduling of telephone and in-person patient visits. Our laboratory team quickly partnered with the local lab for send-out testing and conducted competency testing for an in-house rapid test. Optical, dental, and administrative help with the AM and PM temperature checks, drive-through testing, ordering PPE and other cleaning supplies through the vendors. As the pandemic lingers, the team's focus is to expand our health services beyond the urgent and emergency care in a safe manner. Our team's dedication to our Ho-Chunk community is so deserving of this award.
Hamadakiapi, Chante Weshte Nape Chiu Zapi, Monique Reynolds Amachiapi, Ian Weshloha Amataha, Klowaktaha Awati. Greetings, my relatives. My name is Monique Reynolds. I am the director of the Standing Rock Wellness Program, which is our tribe's suicide prevention program. I consider it an absolute honor to help my people during difficult times. One of my favorite things to do is work with the Standing Rock Youth Council. We make PSAs and sometimes just for fun videos.
Hello, my name is Danelle Smith. I'm a member of the Winnebago tribe and I'm the CEO of the Winnebago Comprehensive Healthcare System. The WCHS was established by the Winnebago tribe to manage the tribe's healthcare programs through the Tribal Self-Governance Program. This includes the Winnebago Public Health Department and the 12 Clans Unity Hospital. The COVID-19 pandemic has brought new challenges for all of us. To help our community respond, the Winnebago tribe declared a public health emergency and created the Winnebago Pandemic Task Force, including multiple subcommittees. I have had the privilege of serving as a member of this task force. The fact that our tribe manages its own healthcare system and other major tribal organizations has helped our community take swift action. I accept this award on behalf of all of the staff at the Winnebago Comprehensive Healthcare System and on behalf of the Winnebago tribe and its Pandemic Task Force. Thank you to the National Indian Health Board for all of the work that you do on behalf of Indian country, and thank you for this honor.
Shio Nagad, Dagwadoa, Wiki Diakachki Zutanola. I'm Vicki Bradley, Secretary of Public Health and Human Services for the Eastern Band of Cherokee Indians. I'm humbled and honored to receive this award from the National Indian Health Board. It is a privilege to be able to serve in my community and be a part of a team that's committed to the health and welfare of our tribal citizens. The commitment that our tribal leadership and partnering agencies have demonstrated during this time has been incredible. Although challenging, this pandemic has continued to provide evidence that increased public health capacity is necessary throughout Indian country. We must continue to ensure that essential public health services are available to all Native people. Once again, I'm honored to be recognized with many other leaders tonight that work so hard to improve population health in our Native communities. Shki.
Hello, my name is Lieutenant Commander Amanda Wyatt. I am a member of the Muskogee Creek Nation. On March 13th, the Muskogee Creek Nation declared a COVID-19 state of emergency. A COVID-19 hotline was established to address the community's growing concerns and questions. Initially serving as the sole point of contact, my role in the COVID-19 pandemic allowed me to utilize my knowledge, skills, and abilities to provide evidence-based recommendations to tribal and surrounding communities, as well as provide staff support. Like many tribes and nations, this year was met with many challenges that tested our resolve and resilience. I am grateful for the opportunity to provide the services that I was able to during these very trying times. I recognize that I have a responsibility in Indian country. As such, I would like to thank the Muskogee Creek Nation for allowing this privilege and honor to serve in this capacity. I would also like to thank the National Indian Health Board for such an incredible honor. Thank you for all that you do and continue to do for Indian country. Mado.
Good evening all, and especially the National Indian Health Board and Board of Directors. Thank you for the prestigious Award of Outstanding Service given to the Choctaw Nation of Oklahoma Summer Food and At-Risk Program. During the COVID pandemic, at the start, we were wondering what was going to happen with our programs, and we were able to find resilience in all of that, and so serve over 70,000 meals during the summer months. So once again, I want to thank you for giving us this award and giving us this honor. Thank you.
As governor of the Gila River Indian Community, I'm proud to accept this Heroes in Health Award on behalf of the community's COVID-19 Task Force. Since the task force was formed in January, when we became aware of the seriousness of the pandemic, the task force members have spent countless hours collaborating and finding resourceful ways to keep our community members safe. It is largely due to their efforts that the community has not been subject to a serious outbreak and avoided becoming a hotspot even when the state of Arizona was the world's top hotspot. I want to acknowledge the unified command of the task force, the senior advisors, the tribal departments, and the members of the executive office and our community council who've come together to form this task force. The task force members have put aside concerns for themselves to serve the community, and I'm certain that their combined efforts have saved lives on the Gila River Indian Community's reservation. I couldn't be prouder at this time to stand with them as we accept this award for the Gila River Indian Community's COVID-19 Task Force.
Hello, my name is Terry Rambler. I'm the chairman of the San Carlos Apache Tribe. There are about 13,500 live here on the reservation. We knew from the get-go that we needed to control the spread of the virus, and the best way for us to do that was to establish an alternate care site.
The mission of the alternative care site is it's a partnership and working together with the Tribal Council, Department of Health and Human Services, and the Tribal Emergency Response Commission, also the Apache Gold Casino Hotel. And so all of us coming together to make a difference for those tribal members that have the COVID-19.
I am Leslie Burnett. I'm a San Carlos Apache tribal member. I beat COVID-19 in the positive environment at the ACS with the support of the awesome doctors and nurses.
When I tested positive, I didn't have nowhere to go. I had issues at home in my household. I was afraid to get my sister and other family members sick. So when I found out about this program, I called because my household, we all tested positive, and I was afraid I was gonna get some family members that I was staying with outside in a tent. I was afraid to get them sick. We had a place to stay. We had meals 3 times a day. They did the vital checks 3 times a day as well, and that helped. They gave us medication and what we needed. They didn't treat you like you were contagious, which is why I liked it here. They showed their emotions, they cared, they wanted you to beat this virus.
My name is Tisha Simmons, and I'm with the Alaska Native Tribal Health Consortium. I am so happy to accept this award on behalf of all of the Alaska Native communities throughout the state, on behalf of the partners we have worked with to bring out the Alaska Blanket Exercise, and the 60+ volunteer facilitators who have done the exercise Thank you so much. We've worked really hard to help people overcome trauma and increase resilience, and it's been an amazing activity. Thank you.
During these challenging times, public health care is taking a very different shape. We all miss being able to talk directly with the communities we serve, to host others, and to attend ceremonies. Although we currently cannot be there for you in person,
we will all still be able to help you from here.
Aztec would like to say thanks to the National Indian Health Board and to those who continue to support our mission and response to the people we serve. Although there is physical distance, we are still connected, and we will see each other again soon.
I'm Emily Matt-Selloway, a member of the Blackfeet Tribe of Montana. I'm honored to have been nominated for the Heroes in Health Award by Embry and the Center for American Indian and Rural Health Equities of Montana State University. I dedicate this award and I'm accepting it on behalf of those who are the real heroes, especially during this dreaded COVID pandemic. To name a few, there are the dedicated prayer warriors, the healthcare workers who are on the front lines. There's students and parents and teachers who continue to do home-based services while struggling, tribal councils and health board directors who advocate for services and funding for our communities, the incident command teams. There are those who have offered and have provided support for our reservations. You know, American Indians continue to be overrepresented in healthcare disparities and now in COVID. I urge our people to please pay attention to the science. Please wear your masks, maintain social distancing. I'm asking the Creator God to bless you, your families, and your communities. I thank you.
By greetings. On behalf of our staff, the tribal nations we serve, our entire USET family, we humbly accept the NIHB Outstanding Service Award. Not only do we accept this award on behalf of USET, but we do so with full recognition of countless other individuals, tribal nations, and tribal organizations who work so diligently on behalf of Indian country. While we appreciate this USET recognition, we understand that our success is only possible when we all work together and exemplify our USET motto, because there is strength in unity. I want to also take this opportunity to thank the National Indian Health Board for its steadfast advocacy in support of advancing and protecting the overall health and well-being of Indian country. 2020 will be a year that none of us will soon forget, if ever. A worldwide pandemic, numerous natural disasters, a national reckoning to hold America accountable for its past in our march towards justice for all, and political turmoil and societal unrest that has caused our divide to widen even further. It has been a year that has taxed us all in ways that we could never have imagined, and we are not yet out of the woods. Once again, I want to thank NIHB for this recognition, its partnership, and its friendship. I want to thank all of you for the important work that you're doing to improve the lives of our people, not only for today, but for those yet to come. In peace, friendship, and gratitude, Katapnul Tamawish. Thank you.
Good evening. My name is Tony Lodge, and I'm a citizen of the Turtle Mountain Chippewa Tribe of North Dakota. I currently serve as the CEO of the Native Project at Spokane, an urban Indian health clinic, and HRSA 330 community health clinic that serves people from over 300 different nations here in Spokane. We have a very comprehensive medical facility that we started out 25 years ago with $100, and we've grown it into a $16 million budget building, which has been truly a grassroots organization. So I am honored to get this award, but it really belongs to the people that have worked so hard all these years and to our community who have been the recipients of our services. I would say that other than being honored and happy in these dark times to get an award like this, is to really offer love to all of you and just a reminder to take care of ourselves. We've seen a lot of sickness and a lot of deaths in the last over 500 years, but it's been accelerated recently. And just to remind ourselves that, got to put on our own air mask before we can help other people. And especially remember that we're doing this for the children. My favorite thing is being a grandma. I feel like I'm the grandma to this whole community. And again, just really thank you from the bottom of my heart. And I thank you for all the good work you do. Your work makes my work better. And I hope that we've contributed something to the overall health care of Indian people in this country. Thank you.
Hello, my name is Dr. Donald Warren, and I'm so deeply honored to be nominated for this award through the National Indian Health Board. And to receive an award like this really is very meaningful for me. In my current role, I am the Associate Dean of Diversity, Equity, and Inclusion for the School of Medicine and Health Sciences at University of North Dakota. And I'm also Director of the Public Health Program and Director of the Indians into Medicine, or InMed program. I'm Oglala Lakota, originally from Kyle, South Dakota on the Pine Ridge Indian Reservation. And I've been very fortunate in my career to pursue higher education and become a physician. I went to Stanford for medical school and Harvard to get my Master of Public Health. And in my experience working in medicine and public health, I know that we don't have enough of our own people in these positions, whether it's as health professionals or leaders in health systems. So one of the things I'm very proud of is that at University of North Dakota, we now have a Master of Public Health with a specialization in Indigenous health. And this year we were able to establish the first PhD in Indigenous health. But it's not just my efforts, it's actually a team effort. And I appreciate Dr. Melanie Nadu for nominating me for this wonderful award, but it really is a team effort. It's not just my work, it's the work of several people and an entire team of people focusing on improving outcomes, and particularly educational outcomes and educational opportunities for our people and for the next generation, to ensure that we are at the forefront of managing our health systems, conducting our own research in a culturally relevant way, and improving Indigenous health. So again, just thank you so much for this wonderful honor. It means a lot to me, but it also means a lot to our team, because it really is a team effort to make these kinds of things possible. So again, thank you so much, and I really appreciate all of the consideration.
My name is Dr. Winifred Booker. I am the CEO and Director of Development for the Children's Oral Health Institute. We would like to thank the National Indian Health Board for this National Impact Award. The Children's Oral Health Institute has delivered the Lessons in a Lunchbox program to 50 states, the District of Columbia, Puerto Rico, the Bahamas, and Haiti, because we've had so many hands on deck from organized dentistry and from our student dentists from 56 dental schools around the country. We're especially grateful to Dr. Jessica Rickard and the Society of American Indian Dentists, who have also reached 11 states, American Indian reservations, and communities where American Indian children and Alaska Native children attend school. So we want to thank you again for this award. It is United We Heal, and we look forward to our continued work with the National Indian Health Board.
Good evening. My name is Frances and I'm an Algonquin tribal citizen. As a CEO for the National Council of Urban Indian Health, we are honored to receive this award for our work on behalf of COVID-19. Since the pandemic started, NIHB has been working to ensure that all of Indian country receives the necessary resources to combat this pandemic that is killing our people every single day. For example, NIHB has testified before Congress 5 times this year, and in July, we testified before the U.S. Commission on Civil Rights. In these forums, we not only advocated for critical funding to Indian country in light of how the pandemic is disproportionately affecting us, but also underscored the failure of the federal government to keep the promises it has made to American Indians and Alaska Natives. Race is not a health disparity factor, systemic racism is. Due to our advocacy, resources for urban Indians were included in all legislation addressing COVID-19. American Indians and Alaska Natives have infection rates of 3.5 times higher than the general population, and the Indian health system would have collapsed without these resources. With our partners, we continue to apply pressure to Congress to ensure appropriate resources are included in every legislative package on COVID-19. Through our advocacy, we have raised the profile of over 70% of American Indians and Alaska Natives living in cities and have built strong partnerships with leaders in both parties. We are working to ensure that frontline health heroes in Indian country receive access to things like PPE, supplies, and testing as their lives are at risk every day. And we will continue to hold this administration and Congress to their trust and treaty obligations. Thank you for the nomination.
Good evening. I'm Rear Admiral Kelly Taylor, Director of the Division of Environmental Health Services in the Indian Health Service. It is my pleasure and honor to accept the National Indian Health Board's Outstanding Service Award on behalf of the more than 110 environmental health professionals within the division. We protect people from the harmful effects of things in their environments. Some of the community-based COVID-19 work we've done was to collaborate with tribal environmental health offices to assist tribal health organizations and communities develop local response plans, education materials, and reopening guidance. A great deal of work has been performed by staff in settings like childcare programs, elder nutrition centers, correctional facilities, casinos, healthcare facilities, and drive-through testing sites. Thank you, NIHB, for the recognition, and thank you to the environmental health staff for their dedication, professionalism, leadership, and service to American Indians and Alaska Natives during the COVID-19 pandemic.
Yate. Hello, my name is Scott Woolley. I'm the Program Coordinator for the Native American Research Internship, also known as NARI, through the Department of Pediatrics at the University of Utah. It is with great privilege to be here today to accept the prestigious National Indian Health Board's Outstanding Service Award for National Impact. The NARI program has helped increase the progression of American Indian and Alaska Native students in health sciences. Several of our participants are in graduate and residency programs across the country with the intent to return and stand with their communities. Please accept my greatest gratitude to all the healthcare workers who are at the front lines managing the COVID-19 pandemic in our Native communities, especially those in rural communities who are nonstop providing the best and quality healthcare that is needed. COVID-19 has been devastating in our communities, but it's also demonstrated how resilient we are as Native peoples. Thank you to the organization and the board members for selecting the NARI program. It is wonderful to be recognized at the national level.
Ani, hello, my name is Cece Hovey, and I'm the Communications Manager for Strong Hearts Native Helpline. I'm an Anishinaabe citizen of the Sault Ste. Marie Tribe of Chippewa Indians. On behalf of Strong Hearts, thank you for this recognition. Strong Hearts Native Helpline is a national, culturally appropriate, domestic dating and sexual violence helpline for Native Americans. We are a collaborative project of the National Domestic Violence Hotline and the National Indigenous Women's Resource Center. Our advocates are highly trained to help American Indians and Alaska Natives who are being hurt in their relationships. Strong Hearts Native Helpline is honored to receive the National Indian Health Board's Heroes in Health National Impact Award, which acknowledges the important role our work has in the domestic violence crisis in tribal communities. Every single day, we provide culturally specific peer support, domestic violence and healthy relationship education, safety planning, and help finding direct services in the victim survivors area. We can be reached daily from 7 a.m. to 10 p.m. Central Time by calling 1-844-7-NATIVE or by clicking on the Chat Now icon on our website at strongheartshelpline.org. Miigwech and thank you.
Goetzi Hopa. Hello everyone, my name is Emilia Pino and I'm from Zia Pueblo, New Mexico. I am currently a senior at Bernalillo High School and I am also a coordinator for the Healers of Tomorrow program. In April, my pueblo was severely affected by the COVID-19 pandemic and was forced into lockdown to protect our people and surrounding communities. During this pandemic, I was able to help assist my community in 2 ways. In May, the Native Health Initiative, Healers of Tomorrow, and Protect NM helped me to organize and donate 1,400 masks and sanitation supplies to my people. In July, my family and I distributed fun and educational care packages to the Pueblo of Zia youth, thanks to an outpour of generous donations. Supporting my community in such ways has been an honor and has helped me grow as a person. I look forward to continuing to help my people and show the love that I have for my community. Thank you.